So Jason has a little bit of a problem going on with his left gastroc, which is his calf, and his hamstring. So we're going to work them out for him today, and we're going to show you a little bit of what to expect if you were to come for a sports massage session. Jason, if you wouldn't mind, face down. Okay, so your calf is made up of your soleus muscle and your gastroc, the gastroc being the largest and the most prominent. So we're all used to seeing our gastroc, the heads of our gastroc muscle, and our hamstring is the back of our thigh. I'm just going to put a little oil on here for a little lubrication. So the problem with having a knot in your gastroc is that muscles are made up of sometimes millions of muscle fibers depending on the size of the muscle. And if you have 80 muscle fibers that tighten up, that's really not a big deal. But if you start to get a few thousand, then what you're going to get is some limited range of motion in your calf. You're going to feel like your calf is not as strong, and quite frankly, it's just going to feel very tight for you. How does this feel, Jason? You feel a little tight area in through here? This is what you were telling me about. So as you can see, my thumbs are getting in there into Jason's tissue. So I'm just going to hang here for a few minutes, do a little bit of direct pressure. What that's doing is bringing circulation right into the area that's knotted. What I'm trying to do is to loosen up the fibers. Muscle fibers can be as fine as hairs. They lie side by side by side. And like I said, as many as a few million of them. And when you get a few that start adhesing together, instead of Jason running out and having his entire gastroc ready to fire for him each time he lifts his foot off the pavement, he's going to lose some of that strength of the gastroc. So he's going to end his run and feel, boy, I didn't quite get as much out of my exercise as I thought I might, and that might then materialize into when he does his race, he's not going to run the time that he had hoped. So we're going to help him out with that. I'm going to loosen up the medial head of the gastroc, the lateral head of the gastroc. Feeling a little better there, Jason. And this can be quite painful if it's the larger the knot. And what I'll be doing is sending Jason home, encouraging him to stretch, encouraging him to ice after he exercises. Ice is definitely the best way to get inflammation. If there is some, there's none present here, but it stimulates your circulation. Because when you put ice in your body, immediately your body says, I've got a cold area, we've got to go warm it up. So it pushes the circulation right to the area. So it'll be like unkinking a hose when you take the ice off. And even though my hands aren't there working on the gastroc to get circulation, Jason, after he takes the ice off, is going to get increased circulation into the area. So he'll be continuing to work on what we're working on here at this session. Do a little stretch here. And as we work the knot out, it's feeling better and better to Jason, and he's feeling less sensitivity, less pain, and it'll feel looser for him when he starts to jog out into his next 10K. Feel the stretch, Jason? Calves are an easy muscle to stretch because even at home you've got the stairs, you can get on the bottom step of the stair, push your heel down, and the whole idea is to keep the muscle fibers nice and open, nice and loose. So as much as I can get the muscle tissue to loosen up here, it's important that the athlete continue to work on keeping things loose before and after their sessions, especially in healing. If there's a problem. We're moving up into Jason's hamstring here. Hamstrings are muscles that get tight for runners because they shorten each time that they run. Again, Jason has a little bit of tension at the musculotendinous junction, which is your hamstring muscles attached to your body at your ischial tuberosity, which is the sit bone of your body. And muscles attach to the bones via the tendons and the ligaments. And that's what I'm working on right here, the musculotendinous junction right at Jason's hamstring, at the ischial tuberosity. And because Jason gets massage on a regular basis, he fits it into his training program. When he does come for massage and has some tight areas, because his body is used to getting massage, it responds very well. Many times people come and the first time they get massage, they can actually feel rather sore the next day. That's because massage, not unlike exercise, can cause microscopic tears at a cellular level while we're going in to repair something or to help facilitate the body to heal itself, which is actually really a better description of what massage does. It's not so much that I am actually loosening things. What I'm doing is helping the body to be able to loosen itself by undoing some of the adhesions that happen, bringing circulation to the area, stretching it. The benefit of the massage will continue for the next 72 hours because the body will be responding to what I've done. So I've really facilitated that healing process. And we have the hamstrings that are the opposing muscle group to the quadriceps, which are the large muscle group in the front of the thigh. The hamstrings are the muscle group at the back of the thigh. You have the biceps femoris, you have the semimembranosus, and you have the semitendinosus. And as much as we all think of the hamstring as a muscle, it's a muscle group of 3 muscles. Each of them work independently, but together as a group. Now that I'm getting some loosening in here, I'm going to ask Jason in a second to flip over onto his back so that then I can stretch out his hamstring. And we're going to do a little bit of what we call reciprocal inhibition, which is sort of a fancy name for resisting an exercise, so that you'll see how massage therapy engages the person on the table to become part of their session, so that they are going to work with me to help facilitate that healing that we need to happen in this hamstring. So what'll happen is if we do not loosen up this tight area in Jason's hamstring, let's say for example, he starts running and needs to lengthen his stride because he's in hilly terrain, he's going up and he's going down. If we don't loosen this, his length of stride will be impacted. And then the next thing that happens to that is the body starts to compensate for where the stride is not as it should be, and then we end up with compensatory issues, and that becomes a much bigger issue where one part of the body starts to step in and help another part of the body, but then it's working overtime, and that's a whole other set of problems. Okay, with that, Jason, I'm going to ask if you would roll over onto your back, please. And we're going to take this hamstring. Jason, I'm going to bring it up and stretch it, and so you're going to let me know if I take it too far. Okay, I can feel that your body is telling me right there. So at this, I'm going to have Jason resist. So Jason, I'm going to push your leg, and I want you to resist and don't let me move it. And relax it. And you can see how that has opened that up for Jason. We're going to do that one more time. Okay, you've seen how it's gone a little bit further. I'm going to ask you, I'm going to give it a push, if you could resist. Right now, Jason's hamstring is engaged, as you can see here. And relax it. Very, very nice. Total increase in his range of motion. If this was my first time working with Jason, it would probably take quite a few times to work out that hamstring to get that range of motion. But because he has incorporated massage therapy into his training, his body now responds a whole lot sooner in sessions.
That was great. Thank you so much. I appreciate it.
Good luck with your event.
Thanks.